I'm Dr. Chris Landon. Welcome to the second annual Developmental Screening Conference. This conference is sponsored by First Five. What it represents is really 2 years now of work towards how can we improve developmental screening here in Ventura County. We started with ages and stages. We've worked with PEDS. You're going to hear from our panel later on how they actually were able to implement it into their practices, and we've implemented it in a number of different ways. Probably one of the, Dr. Bob Rao, I believe is here today, has come up with a table, which you see behind me, which is, of course, almost everything you need to do in every visit. Probably the hardest inch is that first inch. And with that first inch, that's the medical assistant. So basically, he developed this as a table for the medical assistant to know with each visit all the things that need to be accomplished. And then, of course, we have 7 minutes in which to accomplish all those things once the patients are properly screened. Probably the biggest problem for him in terms of implementing the PEDS was that the feeling was by the practitioners was that there were no resources. So that once patients were identified, what were the resources available? So why should they bother to identify? And he's had a meeting with his staff, and you'll hear about how each of these practices has introduced the PEDS and other forms of developmental screening into their practice. We're here from Deanna Handel to kind of kick us off because they have been the funding agency. We'll hear from Dr. Rochelle Tyler from UCLA about the developmental screening tools that are available. We're going to hear, in terms of resources, when is it appropriate for people to see, for patients to see a pediatric neurologist, and when is it really more appropriate for them and their families to be seeking mental health services? How can we help these children who are out of control with developmental disabilities? And then we're going to hear from the community in terms of all the resources that are available. Online, you'll see the resource book, and the attendees today will have a paper manual that includes that. Most importantly, though, Dr. Russell is here, and he'll be talking about early periodic screening and developmental testing, our CHDP program. And we're explaining how this is a small piece of all the things that pediatricians and family practitioners and nurse practitioners, physicians, assistants should be screening for.